Electrical Geodesics Incorporated. Pediatric EEG. The electroencephalogram, or EEG, is a non-invasive test used to evaluate the brain's function. Information from an EEG can provide important information for children with confirmed or potential diagnosis of epilepsy, brain injury, autism, neurodevelopmental delay or disability, attention deficit hyperactivity disorder and learning disabilities, and other neurological and psychiatric problems. The test is painless and should take about an hour from start to finish. An EEG is a common, low-risk medical procedure. Your EEG clinic is equipped with a new and cutting-edge EEG technology known as dense array EEG. Dense array utilizes a much larger number of electrodes than does standard EEG, providing 6 to 12 times the EEG data compared to conventional EEG. Compared to standard EEG recordings, dense array EEG will allow your doctor to better understand and interpret any electrical abnormalities that are detected. To be able to apply such a large number of electrodes without discomfort, EGI has developed the hydrocell geodesic sensor net, used in thousands of recordings on everyone from infants to the elderly. The net is a modern and gentle method of gaining important information about the functioning of your child's brain. Your doctor may have special instructions that they wish for you to complete before you arrive for the EEG. You should wash and dry your child's hair the morning of the EEG, removing any braids or hair accessories. Do not use conditioners, gel, mousse, wax, or other hair products. If you did not receive any additional instructions for the EEG that has been ordered, please plan to arrive at the test location in enough time to prepare any documentation that may be needed at this center. You may want to check with the EEG center on how to best prepare for the EEG and how much time will be needed before your test starts. The hydrocell geodesic sensor net is safe and comfortable for all patients. The sensors are made of a soft material that form-fits to the scalp. With the net, there is no abrasion to the scalp, which reduces the risk of infection, and no gooey paste or gel used in other EEG techniques. The net is dipped in a salt solution to soak the sponges, and then the net containing the entire array of electrodes is applied to the head in a single rapid movement. Your child may notice a wet feeling on the scalp and may be briefly startled, but this feeling goes away quickly as the heat of the head dries out the excess salt solution. The net holds the electrodes in place with a gentle inward pressure, similar to the mild tension of a rubber band. The sensation of the electrodes is uniform across the scalp, with no pinch points, so children usually relax quickly and are ready for the recording to start. EEG recordings with the net are generally possible even with babies and children who have not been successfully recorded with other standard or conventional EEG electrode application techniques. The net is applied so easily and quickly and tolerated so well by children, sedation is rarely, if ever, necessary. After the trained technologist applies the net to the patient, it is connected into the geodesic EEG system, which both records and displays the EEG and a simultaneous digital video of your child. The patient will need to be recorded for a minimum of 21 minutes. During a routine EEG, the patient might be requested to perform some simple and painless activities that help to bring out EEG abnormalities. They include photic stimulation, which is a group of flashing lights similar to a strobe light, and hyperventilation, a rapid breathing exercise.
That's good. You're doing that really good.
The hydrocell geodesic sensor net is removed quickly and easily. The patient will simply need to use a towel to dry his or her scalp, a quick comb, and can then return to school, sports, or other activities. For more information, please contact Electrical Geodesics at info@egi.com or by phone.